Health authorities are gearing up for a huge increase in vaccinations from next month when all Australians over 50 will become eligible. National Cabinet yesterday agreed to make the jabs available more widely at 50 state-run clinics from the 3rd of May. That will be expanded to include the GP network from May the 17th.
So far, 9% of the Australian population has been vaccinated with at least one dose. That's compared to more than half in the US and the UK. But the Health Minister says he's happy with the rollout so far. More now from Jade McMillan at Parliament House and Leanne Wong in Melbourne. Good morning both. Jade, firstly take us through the next stage of the vaccine rollout.
Well, Michael, leaders have decided to bring forward what's known as Phase 2A of the vaccine program. It means that from early next month, anyone between the ages of 50 and 69 can get their COVID-19 vaccine. As you just outlined there will be a couple of stages. At first, the vaccines will be available through state-run vaccination centres and Commonwealth respiratory clinics, and then a couple of weeks later through GPs. At this stage, that age group will only be offered the AstraZeneca vaccine. That's because of medical advice recommending that people under the age of 50 get the Pfizer dose instead because of concerns about rare blood clots, and the government therefore wants to limit Pfizer doses for younger Australians and for people who are already eligible for it under the first couple of stages of the program that are underway now. The Federal Health Minister, Greg Hunt, is urging people over the age of 50 to get the AstraZeneca vaccine. He insists that it is safe for people in that age group. He's already had his first dose and he says he's looking forward to his second.
Following that medical advice is what's kept us as an island sanctuary. We're seeing now near daily record numbers around the world in terms of the pandemic. And, 15 months into the pandemic, it's almost unimaginable that it's getting worse, not better, and we're seeing other countries face the most grim and challenging of conditions. Within Australia, we're safe, but this vaccination program means that it not only protects each one of us, but each of our jabs helps protect everybody else.
The Minister on the show earlier. Jade, some other big news out of National Cabinet yesterday pertaining to India.
Yeah, that's right. India yesterday recorded the world's largest daily increase in COVID-19 cases. The Prime Minister, Scott Morrison, says that leaders have made the difficult decision to reduce the number of people coming in from India to Australia. It means that passenger numbers on both commercial flights and government-assisted flights will be temporarily cut by 30%. And Greg Hunt has said this morning that if the situation continues to worsen, the government won't hesitate to impose further restrictions. At the same time, the government is also making it more difficult for Australians who want to go from Australia to India. It's putting together a number of countries that it says are high risk, places where COVID cases are escalating rapidly. It says that anyone wanting to travel to those nations will only be able to do so for strictly essential reasons.
Thank you, Jade. Let's go to you, Leanne Wong. Two new mass vaccination hubs will open in Melbourne today. What will that mean for that state's rollout?
Good morning, Michael. Well, what that essentially means is that more people hopefully can and will get the vaccine. We were down at the Melbourne Convention Centre on Wednesday when the state's first 3 mass vaccination sites opened, and at the time it seemed fairly sluggish with the rollout. Not that many people seemed to be turning up, but the Victorian government says that by the end of the day, 10 times more people were vaccinated at these 3 sites compared to the week prior when these sites weren't yet opened up to the broader public. And it's likely they'll be hoping to replicate that same success at these 2 new sites. Now, these 2 new mass vaccination sites will be at the Heidelberg Repatriation Hospital and Sunshine Hospital, and that also comes after the federal government's announcement that eligibility for the vaccine will be expanded. So right now at these sites, anyone falling under the Phase 1A and Phase 1B categories, so that's quarantine workers, frontline health workers, as well as people aged over 70 can go and get the jab at these now 5 mass vaccination sites. But from May the 3rd, all Victorians aged over 50 will be eligible at these sites to also get the vaccine. Now, on Monday, the Victorian government has also announced that a sixth mass vaccination site will be opened at the Mercure Hotel in Ballarat. And the Victorian government also says that more mass vaccination sites will be opened in the coming weeks.
Leanne Wong, Jade McMillan, thank you both for the updates there.